kind of part of it. Dr. Lennon will be making commentaries on us as we go along, correcting our mistakes. So, first of all, let's start with the skull. It's made up of 22 bones, or 28 bones, whichever you decide. 28 bones if we include the ossicles, right? That's the malleus, incus, and stapes. But we're talking about structural bones now, so 22 of them in all, of which 8 of them are in the part that houses the brain, and that's what we call the neurocranium. And the other 14 are in the anterior, the facial part of the skull, which houses in which they have the nasal cavity and the oral cavity, and this part is called the visceral cranium. Some of the bones are shared by both. The ethmoid is one, for example. And what I'm going to do today, see you've actually know many of the facial bones that will start with your cranium. So there are 8 bones there, and we have 4 that are solitary bones. So if we start on not really going to go on the inside too much, but we have contribution from the ethmoid, the sphenoid, the occipital bone, and the frontal bone. Those are the 4 that are 2 pairs, so 4 single bones, and 2 pairs are the 2 temporal bones and the 2 parietal bones. Okay, so those 2 bones will be encountering today. As I say, I'm talking about the outer part. Okay, so normally we describe the skull, we describe it from different views. So we have the view from above, we call it norma verticalis. The view from the posterior part, we call it norma occipitalis. From the frontal, it's the norma frontalis. Then the lateral, norma lateralis, and then inferior is the norma basalis. So we're going to start at the top of the skull, right, the upper part, and then we're going to work around the different areas. First bone we encounter here is the frontal bone, which is now most of the lobes of the brain get their names from the bones. So the frontal lobe is associated with the frontal bone, the parietal bone with the parietal lobes, the temporal bone with the temporal lobes, and the occipital bone with the occipital lobe. The frontal bone is a pretty big bone, right? It covers the anterior part of the skull, and also it forms the floor, most of the floor of the anterior cranial fossa. Also extends down onto the face and forms a significant part of the forehead and the orbit. At birth, it's not one bone. It's usually 2 bones joined by a suture along this line, right down to the dacian. That suture is called a metopic suture. Metopic, M-E-T-O-P-I-C. That suture usually closes by about 9 months the latest. Between 3 and 9 months. Okay? Sometimes it persists, and later in life somebody might have a head injury and you do a skull X-ray and you see a line, it's a pretty straight line down the middle. You probably should think of a metopic suture to patient that has the symptoms. Where the frontal bone meets the parietal bone, we have the frontal bone meets the parietal bone, we have the coronal suture. And where the 2 parietal bones meet, we have the sagittal suture. Now, these bones, most of the bones of the neurocranium, the bones that form the base of the skull, they usually are derived from endochondral ossification, whereby the bones from the skull cap, which we call the calvaria, is usually from intramembranous ossification. So when the child is born, these flat bones really are separated by sutures. Well, they're separated by membranes initially, right? And the sutures are not there at that point, just membranes. And then as we go along, the bones develop more, and then eventually they will close at fibrous sutures. Okay? So the fact that the kid is born with a membrane in between, it helps. For example, as the head is coming through the birth canal, you get some overlapping of these flat bones. At birth, there are areas where there are two or more bones. They're usually fontanelle, and we have an anterior fontanelle at this point, shaped like that. And most of you who have a kid brother or diamond shape here, kid brother or kid sister, might have felt this area where it's just membrane, and it's the brain right under that membrane. With time, all of this will ossify. Right? There's another, there are a couple of fontanelles, there are some even at the other points, but the two important ones, the anterior fontanelle and the posterior fontanelle, right at the lap, where the two parietal bones meet the occipital bone here, right at this point. This one closes usually by about 3 to 9 months, okay? It's about 18 months. One of the things about the anterior fontanelle, when you get into pediatrics, you find that it's very helpful in assessing the hydration of a kid if it comes into vomit and diarrhea, so who has dehydration. Sometimes you can't really pick up the dehydration from the skin like in an adult, but the fontanelles might be at that stage might be helpful. If they depress, then maybe that the kids are dehydrated. The parietal bones, right? There are two on either side. By the way, come back to the sutures. Very good. Here's one. Mr. Gardner has all the specimens. And here's a metopic suture that has persisted. Right? Metopic suture has persisted. All right? So it's a very, very good. So you can see that following an accident, they have somebody with pain and headache, and you do an X-ray, you might think that there's a fracture at that point. Okay, all right. I know you have good kids with the anterior fontanelle, but that's not no, that's okay. All right. So there's much to first of all, I just want to point out the points at which the sutures meet. Right? Okay, so this is the coronal suture, this is the sagittal suture, and this one here between the two parietal bones and the occipital bone, this is the lambdoid suture. And the points at which they meet, we call them, they have names for them. And the names are, some of them are very difficult to remember. But this one you should remember, the bregma, this point. The one back here is the lambda. This is the lambdoid suture. Sorry, this is the coronal suture. This is the sagittal suture. The lambdoid suture. This is the lambda. These points here are the asterium. At this point, asterium. And we have one important point which I'm going to talk more about when I come to the lateral side of the skull, and that is the theria. That this skull is a very nice theria. H-shaped theria. Okay? Okay? So that's the point at which the parietal bone meets the temporal bone, meets the greater wing of the sphenoid, and the frontal bone. That's the third. Then leave that there from the lateral process. Okay, so we come around to the occipital bone. There are some emissary veins that sometimes come from, they come from the scalp and they drain into the internal venous drainage in the skull, which are the dural venous sinuses, which you'll meet up tomorrow. And, very important to know these emissary veins because sometimes the infection in the scalp can spread into the brain from into the skull from the emissary veins. The mastoid is a noted place for that in children. There is a fairly constant emissary vein in the left parietal bone, but not too many skulls actually. It's there, one there, it's pretty small. But we're going to come across two others that are much bigger when they come to the occipital bone and the temporal bone. So let's go to the occipital bone. Occipital bone, here is made up of there's four parts to it. Okay? There's the pars dissalis right here, or called the basi occipital, that goes up and joins with a part from the sphenoid, which is called the basisphenoid, and together with the basi occipital, the basisphenoid, and the dorsal cell, we call that here the climax. Okay? So the pars dissalis, the only thing you've met on that before, it's the public pharyngeal tubercle, which is right at this point. We've got that when we did digestive, right here, right pharyngeal tubercle, right here. And here is a very, very nice picture of an anterior fontanelle. Okay? Very, very nice. Okay, so that's a great picture below there. This is a posterior fontanelle, which is much smaller. A nice picture of an anterior fontanelle. The other thing about the neonatal skull, that if you look, you see how the bones of the skull are developed more compared to the bones of the face, right? Because what has happened is that the sinuses have not formed as yet. Okay, so these bones are underdeveloped. That's why babies have a big head and a small face. At the time, see that the head was bigger. Right? Here we see another one. This is the aspera. This is another fontanelle. This one clinically is not very difficult to feel. These are the two that you can feel. This one especially, the anterior fontanelle. Right? As you can see here, also. The mastoid process has not developed as yet, so we're going to be talking about that, okay? And
the occipital bone is in parts.
yes, right. Again, the occipital bone is in parts there, very good. This is the pars dissalis, pars lateralis, and the squamous part. The four parts: pars dissalis, pars lateralis, and the squamous part. And those four. They surround this big entrance here, which we call the foramen magnum. You know, most of you have met that before. Alright? So, that's very good. And if we come back, so from the pars dissalis, so just basically there's not much to see here except the pharyngeal tubercle. Then as we get the pars lateralis, we also call it condylar part. Because what it really has in it is these two big occipital condyles, they're kidney shaped. Right? So the occipital condyles, and then we're going to see in front of behind the occipital condyle, the condylar fossa, right? The occipital condyle, the condylar fossa, and the third thing you should look for there is the hypoglossal canal. So we show the hypoglossal canal, and that is outside. There we go. This is the occipital canal, right? Okay. Sorry, the hypoglossal canal. Then the hypoglossal canal comes through. The other thing that I'm going to be talking a little more about the foramen magnum and the condyle, but it's going to show you that they have dorsal canal, and then here the condylar fossa. We have this big foramen here, right? Okay, and this is where big emissary vein comes from the muscles that are here on the posterior aspect of this of the blood one, and there's a big emissary vein that runs in here. The book says that it drains into the sigmoid sinus, but more sometimes this one don't seem to drain more into the bulb of the sigmoid, okay. Sigmoid. So that's what it's called. Sigmoid sinus, okay? Now, so that's we've dealt with three things. So we're going to spend a little time talking about the foramen magnum and the occipital condyles. These occipital condyles are kidney shaped. And you can see that they're going to fit into the kidney shaped superior articular facets of the atlas here. Right, okay? Right? And that's and at that joint, that will be the atlanto-occipital joint, okay? And that joint is main action there is nodding of the head. Nodding of the head. Right, okay? We're not going to be talking about the cervical spine today, but I'll show you that. Remember that at this point, the atlas from the hilum of this superior articular facet, there's a transverse ligament that runs across here, right? That keeps the odontoid peg or the dents in place. Right? Now, that transverse ligament, when I'm going into this, I'm going to show you some attachments around the that you have to know around the so here, this is the odontoid peg. It's the anterior arch of the atlas, okay? And the transverse ligament will be running across here from the hilum of the kidney, and the kidney is the hilum of the kidney shaped superior articular facet. It also has a longitudinal path, right, which runs from the axis to the foramen magnum, okay? And that's the vertical leg of what's called Kutzbaum ligament, okay? So I'm going to show you some things that are attached at the anterior part here of the foramen magnum, right? First of all, there is a membrane that comes from the clivus, right? That comes down and goes down to the attached on the axis, the anterior part of the axis. That membrane is called a tentorial membrane, and that membrane, pectoral membrane, that membrane becomes the posterior longitudinal ligament of the spine. So it's going to go down onto the post. All of this is going to show these things. It's going to go down on the posterior part of the axis here, right? Okay, that's called the pectoral ligament. So the first thing we then come to, right at the rim here, is the dura mater. The dura mater from the brain is come from the skull, right? It's attached all the way along the foramen magnum. Then we have the dura being attached onto the margin, right? Onto the margin, okay? Yeah. Pectoral membrane. Then we then have that vertical limb of the cruciform ligament will be next. And then if you look at the dents here, it has three ligaments coming from it. One called apical ligament and two are called alar ligaments. So those will be the next thing will be attached there in front. Right? Here. So we have the pectoral membrane and the dura, then the cruciform ligament, and then afterwards we'll have the ligaments from the dents. Right? Okay? Remember the dents will be right over here. Right? Okay? And then last but not least we have the anterior occipital ligament, okay, which goes right around anteriorly, runs between the whole of the anterior arch of the atlas and the foramen magnum, and then a posterior atlanto occipital ligament, which is going to run posteriorly here also. That's a lot for today. It's a lot for Alright, now we should know the things that go through the foramen magnum. And when I ask students, there is a spinal cord, but the spinal cord really starts at the first cervical vertebra, so it's the lowest part of the middle that comes through there. Right? The lowest part of the middle. What also goes up there with the vertebral arteries. Right? Okay? And those vertebral arteries run in the set up in the foramen transverse on the cervical spine, and then they will come up and go into the skull at that point. We also have the spinal accessory nerve, it's going to go back in there, and we also have the anterior, single anterior spinal artery coming off from the vertebra, and the two posterior spinal arteries coming off there. Let's move on to the squamous part, right? Okay? And we have here, much better. Right, there we have the superior nuchal line, which we met before, because you remember we did the external mastoid attached to the lateral part of the mastoid process and the lateral half of the superior nuchal line, and then we also have the trapezius, which is attached there. This line will go right on, we follow it right around, it comes on over the lateral aspect of the mastoid, and then goes into this is called superior mastoid crest. Supramastoid crest, supramastoid crest. It's going to go right on to the diagonal arch. Right? This is a very important point here. This is called external occipital protuberance. And this point here is called the inion. Inion. I-N-I-O-N. I'll show you two other areas I showed you before at the foramen magnum. The middle of the posterior part of the foramen magnum is called the basium, and the middle of the anterior part of the foramen magnum is called the opisthonum. Sorry. Okay, sorry. Opisthonum and the basium. This is the basium. The basium anteriorly and the opisthonum posteriorly. Right? They're what we call craniometric points. Right? Craniometric points, same as we talked about the rectum, the lambda, the posterior, the perineum, and these two, right? And the anterior, the craniometric points. What we mean by that is that we use them for comparison skulls, probably most commonly done in anthropology, but also in medicine, we compare skull with those measurements are important and whether or not skull with normal limits and all that. So craniometric points, okay? You should know these two, right? The basium and the opisthonum. Right? This external occipital protuberance, I don't want to steal Dr. Professor Wilson's thunder. This is marked the external surface marking for this area here on the internal occipital protuberance, where the sinuses meet. I believe that's not Professor Wilson, but there's a confluence of sinuses here, right? Confluence of sinuses, okay? And this is sagittal sinus going off here to the right, straight sinus. We didn't do all that tomorrow, so I'm not going to spend much time there. But can you imagine a confluence of sinuses, a lot of pool in this area, and if you want to get a fracture in this area, right? Then you can be serious trouble there, or be fatal, right? Okay, in this area, this confluence of sinuses, we have a name for it. It's the torcular herophily. Right, okay? Torcula. C-U-L-A. Herophily. Herophily was an ancient Greek anatomist. Okay, so it's called a torculus of Herophilus. Who Isaac did. Alright? That's Herophily. Herophily. L-I-I. Alright? A bit of a tongue twister, isn't it? Alright, so we can leave the voice, the line there. Okay. This is the superior nuclear line, which goes, as I said, goes all the way over, right, into the supramastoid crest. And this is the inferior nuclear line along here, right? Okay? Superior nuclear line is also the external marking of the transverse sinus, which Professor will normally show you, right? There is a highest nuclear line, not always easy to see. That's where the apotheosis starts. Highest nuclear, not always easy. You know, the superior nuclear line, the inferior nuclear line, right? Okay. We come to the lateral aspect of the basolaterales now, and that is, if we follow, first of all, the supramastoid crest. But first of all, now we come to the temporal bone, right? Okay? Temporal bone is made up of 5 parts, right? Now some will say 4 parts. And I'll tell you why. One part is the petrous temporal bone, and this is this mound that we see here on the internal part, the petrous temporal bone. And what the good Lord said, Peter, I want to rock on thee I shall build my church, right? Okay? Petrus, right? Okay? Right? Petrus temporal bone, right? The professor said, about that. That continues on the side here, right? Which we have the petrous temporal bone here, which between the greater here and the squamous part of the temporal bone here and the occipital bone, right? So that's all the way along here, right? Okay? This is the inferior part of the petrous temporal bone. Now, because this part wasn't here at birth, a lot of people think of this as a separate part. So one part is the petrous temporal bone, and 2 is the mastoid process. 3 is this part here, which I'm going to show you. It's called a squamous temporal, right? Okay, and that also has this zygomatic process which goes to form the zygomatic arch. Then we have most of these bones, the styloid process is gone, right here, the styloid process. These plastic skulls, they always have them, right, still. This is the styloid process here. Right, so that's the 4th part. The 5th part, right, this bit here, it is called the tympanic. The tympanic bone, right, okay? So we have the petrous temporal bone, mastoid process, the tympanic bone, right, okay? And the styloid process, and the squamous part of the temporal bone, right, okay? That's a good way to think about it. It's a pretty complex one. So we're going to go through a little bit about these various areas, okay? If we continue along here, right? This is the supramastoid crest. First of all, let me just finish with the mastoid process, right here. Mastoid process is a deep groove on the medial side here, right? And that's called the digastric notch. Another posterior belly of the digastric muscle staff. Anterior belly is meant when we did on GIT, that goes into the digastric fossa in front here. Has an intermediate tendon right at the pad going on, right? Mastoid incisor, mastoid incisor, right? Also called the digastric. I think some people might prefer the digastric, no? Yes. Exactly. Mastoid incisor. There's another notch here, and that's for the occipital artery, right? Occipital artery comes through here, right? Okay. Now we come along, we're making some progress here. This is the external auditory meatus, and this little spine that you see here is called a spine of Henle. Spine right here, spine of Henle. Alright? That's spine of Henle. If we were to, this is the supramastoid crest, this is spine of Henle, and if we take a line from the posterior part of the meatus, and what we have here is McEwen's triangle. MACEWENS, McEwen's triangle. Why that's important is because sometimes as a kid, you have a faucet in mustard and you want to drain it, and that's a safe place to drain because you go down there, you can trickle down into the mustard antrum, right? It's about 15 millimeters deep over here, right? Okay? So, McEwen's triangle. So we're looking at the acid McEwen's triangle. Okay, if we go along, we'll start with this is a good point now to talk about the terror, right? Okay? I like this skull because it shows it very well, right? This is the squamous part of the temporal bone, right? Muscular squamous part. If we look here, this is the squamo-parietal suture. This is the squamo-sphenoidal suture, right? Okay, and this various you name the suture about the bone that are around. Okay, so if we look here now, we see that this is the frontal bone. This is the greater wing of the sphenoid, right? Okay, if you see much better from the side, but you also see the inferior part of the skull. This is the parietal bone, and this is the squamous temporal bone. Right? Now that's the surface marking of a very important vessel which runs on the inner aspect of the skull. Right? If you look here, I know most of you know most of these foramen already. Right? This is the foramen spinosa. Right? Right here. Foramen spinosa. One of four on the crescent. Right? So I'm going to take away from
You're not a loaded side.
I know. Okay, anyway, I'll just show you the correlation. Okay, this is the middle meningeal that runs here, anteriorly on the top. I'll leave that at the top for the professor. But if you look at the skull.
No, we can't see without the concept.
Alright, the bone is very thin, right? Okay? And if you do get a fracture at this point, right, then you're right as the surface marking of the middle meningeal, right? Again, and that will give you an extradural hemorrhage, an epidural hemorrhage, right? And you'll understand that better tomorrow when we talk about meninges and certain sciences, right? Okay? But what happens is you get bleeding between the inner layer of the dura mater, between the dura mater and the bone, right? Okay? That's going to accumulate, and eventually you're going to get patients that lose consciousness. I always remember one case when I was doing neurosurgery many months ago, where the youngster was playing in man shop, and a football hit there. He fell, was unconscious for a while, briefly, and then recovered again. What we call elucidated blood, okay? And then subsequently started deteriorating. By the time we got him here, he had an epidural hemorrhage, which was pressing his brain, and luckily we were able to drill a hole at this point, and let out the blood, give things to breathe, and try to find the baby. Okay? The elucidated blood very elucidated blood. Initially, you get a high concussion, right? And then you recover from that. Okay, that's a blow to the head. Then as the blood accumulates now, right? Okay, then you start getting pressure on the brain, and then you're going to become unconscious, right? Okay? So there's an interval where between an initial event, right, clear, lucid, and then you start to become deteriorating again. Okay? That's all I think, sorry. Okay, so Professor Lugota, that would be. We come to the zygomatic arch, right? The zygomatic arch, right, made up of the zygomatic process of the squamous temporal bone and the temporal process of the zygoma. And this is sort of that chair, the regular needed, the chair, the parasitic gland below, behind, right? There are some important structures along here that we should know. First of all, I know comes out there, runs right up here, along with the superior, superficial temporal artery. And if you put your finger right in front of the tragus, right, you feel the temporal pulse right at that point, okay? Right? So, as you come further anteriorly, remember we have the 5 branches of the facial nerve, everybody remembers that? TZBMC, the Zanzibar bimodal. Is that how you know it? How do you know that? That way you remember that. I live in Africa for years, I know, quite near Zanzibar, so I know. The Zanzibar is a part of Tanzania. Zanzibar bimodal.
Zanzibar by
TZBMC. Temporal, zygomatic, buccal, marginal mandibular, and the cervical. Alright? The 2 of them are here. Right? Sometimes you get a fracture here, you can damage one of those structures. Right? Right? The temporal and the zygomatic branches of the facial. Right? We'll show the facial comes out in a while. Okay. We get into this area. If we look at the zygomatic arch, we see that it has like 2 roots. When we come back here, one root goes back to the supramastoid first, the other root comes across here, and this is going on to this area now, which is the greater area sphenoid. Okay? And this area is called the articular eminence. Right? The articular eminence right here. This is called the articular tubercle. So this eminence is part of the articular facet of the temporal mandibular joint, right here. Okay? Alright? This is good to the top. Okay, the temporal facet a little while. Alright, okay? Try and finish up on the temporal bone here. Right? There's a suture here between the squamous, all this is squamous temporal, and this bone. Let me just tell you a little about this bone. This is called the tympanic part of the arm. The tympanic part of the vertebrae. Tympanic part of the temporal bone. And this is U-shaped. So it forms the bony part of the external auditory meatus, and the roof of it is formed by the squamous temporal bone. Okay? So the bony part of the external auditory meatus is this tympanic part of the temporal bone, and the squamous part of the temporal bone that form the bone. Right in this little area here, right? This is called squamo-tympanic suture. Right here. Fissure. Squamo-tympanic fissure. Right along here. This one shows it a bit better. Right here. Between the squamous part of the temporal bone and the tympanic part of the temporal bone. Now, if we look at this little piece of bone that wedges itself here, this bone is now coming from this is part of the roof of the middle ear. The roof of the middle ear, which is right here, right, okay? Alright? This is called the tegmen tympani. Right?
We're not seeing.
The tegmen tympani, right, okay? The part of this now, right, comes down, right, and wedges itself there. This is the descendant part of the tegmen tympani. And it divides this fissure into 2 fissures. This one is called the petro anteriorly here. You can see it right there? Right here. That's not a very important one. It's the petrosquamous. This one is the petrotympanic. And you would have met the petrotympanic fissure already because what? What comes to it? Call it tympanic. Call it tympanic runs here, coming from the middle here. Right, okay? And then it goes right around the sphenoid process. And the sphenoid process here, again, not shown as well as it is on the plastic board right here. Okay? So that's it. That's the here. Isn't it? This is the jugular foramen. You see it right here now. Okay, so the medial side of the mastoid process, right here, jugular foramen. Jugular foramen. It It's formed by two bones. This is the jugular fossa, which is part of the petrostemporal bone, and the jugular notch, which is part of the occipital bone, right? Okay? And that's where the bulb of the internal jugular vein is, right? Okay? That comes out here. Right? The other things that come out at that point, and I'll show you something on this one, which is very interesting. If you look here, you can actually see all of this here, the jugular foramen, and it has a calcification line where normally there's the dura that separates the anterior part from the posterior part, and here we have it's ossified. Okay? Right? So all of this is the jugular foramen. From the anterior part, it's going to run the nerves are going to come out there, and there's the glossopharyngeal, vagus, and thylacis. Right here? Alright? Yeah, three compartments. The anterior part is the inferior petrosal vein. It's a good Professor Ruben will show you. That's going to run down to join the bulb of the jugular vein, right? And then another nerves, right? We continue on and we come to the apex of the petrostemporal bone. This part is called the quadrate tubercle, right here. Quadrate, sorry. Before I get there, we have important things to show you. Just anterior to the jugular foramen, we have the carotid canal, right? Everybody can see that? Carotid canal. Now, the carotid canal, that's where the internal carotid artery enters, but it doesn't go into the skull directly. It doesn't run in the canal and then comes up to the upper part of the jugular of the foramen nasera. Okay, Professor will show you over that. Okay, in between the jugular foramen and the carotid canal, we have this opening. Let's call it tympanic caniculus. There we go, tympanic caniculus. This one also, very nice to hear. Here, this is the carotid canal. This is the jugular foramen, and that's the tympanic caniculus. And through that enters the tympanic branch of the glossopharyngeal nerve. That's going to provide innervation to the middle ear, sensory innervation. It's also going to provide a lesser petrosal nerve, which you will be dealing with, which you've met before when you get the OT catheter. Okay? All right? That's going to, again, we're going to discuss it. I'm going to leave that for Professor. Alright? If we look here, the lateral part of the jugular foramen, you can see a small hole there, and that's the mastoid caniculus. Here, mastoid caniculus. Alright? And that's where the tympanic branch of the vagus nerve, right, enters. Okay? That's what they do. Right? The auricular branch, sorry. That's why it's good to have ocular engineers. Arnold's nerves. So the other nerve, the tympanic branch of the glossopharyngeal is called Jacobson's nerve, and the auricular branch of the facial is called Arnold's nerve. Okay? That's what provides sensation to the air. Okay, this is a quadrate. We'll go now to the apex of the petrostemporal bone, and this is the quadrate process. And then one can tell me what arises here. Then so what? The beta or tensor? The beta palatine arises here. Okay, right? That's a rundown to the upper part of the palatine aponeurosis. Okay, right? Now, this is called a quadrate area, right? Okay, and here we have the foramen nasera, which in real life there's some fibrous tissue and some people say cartilage that's formed there, right? Okay, but that foramen nasera is formed between the greater medial sphenoid here, right? Okay, and well, not the pterygoid tubercle, it's called the pterygoid tubercle, which is associated with the middle pterygoid vein, right? The apex of the piece of temporal bone and the basi-occiput, the basi-sphenoid area. So that's the area that we have the foramen zero, right? Oh, yes. Here we have the sphenoid process, okay, which we mentioned earlier, right? The final sphenoid, right? And we remember, just in front of it there we have the stellamastoid foramen, right? Now, sorry, no, sorry. Foramen spinosum, sorry.
Relax.
Foramen spinosum. Foramen spinosum and foramen ovale, okay? Right? And I have to mention that stellamastoid foramen, that's so right, okay? Posterior to the stellar process is the stellamastoid foramen. Okay? And everybody knows what comes through there, the facial nerve. And artery enters at that point, but the stellamastoid artery. Okay? The stellamastoid artery is the back posterior of the artery. Okay? As it comes out here, it's going to divide into this. It's going to run it's going to go into the parotid, right? And then it's going to divide into the side branches, and then they're going to be facial muscles. So what I'll do, I'll just go. Now, the greater weight of the sphenoid makes a significant contribution to the inferior part of the base of the skull here, right? Okay? And the junction of the weight of the sphenoid and the body of the sphenoid is going to have these two plates coming down. And this is the lateral pterygoid plate and the medial pterygoid plate. Right? Now, this area is the infratemporal fossa. The infratemporal fossa runs from the posterior part of the maxilla back here to the styloid process with the cartilage sheath. Medially is the lateral part of the lateral pterygoid plate. And then we're going to have a superior constrictor right here. And then it's going to go laterally, right, okay, to the inner aspect of the ramus of the mandible and the temporalis muscle, which will be inserted in the coronary process. Okay? So that's where the infratemporal fossa is. Right? That's two important foramina that come down from the roof of the infratemporal fossa. This is the foramen ovale and the foramen spinosum. We spoke about foramen spinosum before, right? Okay? Right? There's a little bit of geometric roots. And the foramen ovale, right? We should know what the main thing that comes together is the mandibular branch of the trigeminal nerve along with the motor branch. Right? They come through and then they're going to unite just as it gets into the infratemporal fossa. Right? Then we also have the accessory middle artery. We have the lesser petrosal nerve and emissary vein, right? So called MVLE, right? We're going to move along because everybody has to have a say today in the skull, so let's just talk about the lateral medial pterygoid plate. We met this up before, right? Remember that the lateral pterygoid muscle arises from the lateral aspect and the roof of the infratemporal fossa. Medial pterygoid plate, medial pterygoid muscle from the medial inner aspect of the lateral pterygoid and from the tuberosity of the maxilla, right, and the pyramidal process of the palatine bone, right? Now, medial pterygoid plate, right, comes right down, and here, as it gets down here, right, we have the scaphoid fossa. Right, focus up here to the scaphoid fossa. Scaphoid fossa. This is called the pterygoid fossa up here, the scaphoid fossa. And arising from that, we notice the other the tensor palati right here, right, from the scaphoid fossa, and also from the cartilage of the pharyngo lymphatic tube, we also call the eustachian tube. Now that runs in this sulcus here, right? Again, it's called the sulcus tubi. So the cartilaginous part runs here, right? Go into the pharynx, right? Well, here's the bony part, right? Of the pharyngeal lymphatic tube, right? Bony part of the cartilaginous part, right? Okay. Now, this is called a pterygoid tube, and Dr. Cullen has put a lovely suture in this called everyone in mind is everyone I should go. But hidden under this tubercle is the pterygoid canal, right? It's hidden under this tubercle here. I'm not going to take away from I'm hidden under the lingula of the foramina serum. So it runs between them, right? Okay? Lingula of the foramina serum here.
Lennox, you have to tint it, you can't see. So it's called tinted. Tinted wrong.
Okay. The lingula of the foramina serum here, right? Okay? And the pterygoid tubercle here. And this here is the lesser, the greater petrozoa. Greater petrozoa is going to run in here. Remember?
Lennox, you have to show it at the lingula. In terms of orientation, it's called indeed the lingula.
Yeah.
Turn the skull at the end. Oriented here.
Yeah, okay, it's better there. Lingula.
No, you see.
Lingula here. Right, okay. Like on top there, okay. Right? And so from the, remember that the foramina serum, the lower part of the foramina serum is closed off, right? This is going to run in between these two, the lingula here. And the pterygoid tubercle here, pterygoid tubercle is at the base of the medial pterygoid plate, right? Okay? Right, and that's what's going to run. And it's going to come out of the hiatus fascialis, right? Okay? Hiatus fascialis, which is right here. So you can see that here, okay? And then there's another mark that we made in this one, and then that's where we're going towards the foramina serum. The less petrozoa is going to come out to another little foramen here, and that's going to run towards the foramina bladder, right? Okay? So this is the groove for the greater petrozoa and groove for the lesser petrozoa. Right? Now, one other thing that you can see here very well in this one is the palatal vaginal canal. Right? Palatal vaginal canal, right up here, right away by the bone here. But it's on the medial pterygoid plate of the upper part, and we can see it, and through that comes the pharyngeal nerve. And that's something we mentioned before, and pharyngeal nerve is going to come from the pterygopalatine ganglia. Okay, right, okay? And that's what is provided innovation and security water innovation also for the pharynx, the pharyngeal nerve. Right, okay? Let's quickly go through the face, right? Okay. Right? We've met most of these things before, right? Okay. So here, I just remind you, right? The orbit, right? Okay. Frontal bone. This is called the nasion, right here. It's called the glabella, And this is a superciliary arch. Superciliary arch. The superciliary arch marks the external impression of the frontal sinus also here. Okay? This is the orbit, right? You do the nasal bones and the bones around the mouth quite well. Remember on the facial skeleton, now to the visceral cranium, you have 8 bones in the neurocranium, and you have 14 bones here in the visceral cranium. Okay? On top of the 8th one. Okay? So we have, let's see if we can look at that. Right? We have we talk about below the front. Okay? We have the vomer and the mandible, so those are the 2 single ones. Right? Then we have the ethmoid, we mentioned that already. And then we have a lot of paired bones. Here we have the nasal bone that's paired, the maxilla that's paired, the lacrimal that's paired, palatine that's paired, okay? And the zygoma that's paired. The orbit is made up of 7 bones, right? Okay? And it has 2 of the bones. The orbit is like a pyramid, right? It has 4 walls, a roof, a lateral wall, medial wall, and a floor, right? Okay. All right. So I'm going to handle what I'm going to show you is a supraorbital foramen here. The infraorbital foramen here and the mental foramen here, okay? And I'm going to hand over